Now we will continue the last part of the lecture regarding the physiological changes of pregnancy and labor. There is endocrinological changes of pregnancy, includes the placental hormones. The human chorionic gonadotropins, estrogen, progesterone, and human placental lactogen all are placental secreted hormones, and they are essential for normal pregnancy. The human chorionic gonadotropin is a glycoprotein produced by the syncytial trophoblastic cells of the placenta into the maternal blood. It consists of two subtypes, part A and B subunits, and they can be detected in the maternal blood from 9th day after fertilization, and its level in the plasma is doubled every 2 days in early pregnancy, and it reaches to a maximum level about 10 to 12 weeks of gestation. It's about 50,000 to 100 international units per liter, and then it decreases to a plateau throughout the whole pregnancy and reaches about 18 to 20 weeks plateau and continues. Its main function is to maintain the corpus luteum early in pregnancy. This corpus luteum will continue to secrete estrogen and progesterone. Also, its function is to induce immunological tolerance in the mother. This hormone is a vital hormone for detecting and diagnosing the pregnancy. We send for the beta subunit of HCG test, and if it is positive, we say yes, this is a pregnancy condition. In male fetus, the HCG stimulates the interstitial cells of the testes to secrete testosterone and enhance the development of the male sex organ and descent of the testis stimulation of the fetal adrenals. As we mentioned, the beta subunits is a unique to pregnancy because there are many hormones in the body have the same A subunits, and these hormones, FSH, LH, TSH, all of them, and HCG, all of them had the same or similar subunit A, so we don't send for subunit A. But B subunit is specific for pregnancy. Estrogen is produced by the placenta, increasing towards the latter part of the pregnancy to reach up to 30 times in normal female level, non-pregnant level. Estrogen is produced by placenta from precursors from maternal and fetal adrenals, which secrete weak androgens that are converted by the placenta into estrogens. The estrogen function causes the enlargement of the uterus, as we mentioned, from 50 gram to 1000 gram, responsible for angiogenesis, formation of new blood vessels, stimulation of protein synthesis in the body, cholesterol metabolism in the liver, sodium and water retention, enlargement and development of the breast, ductal system mainly, enlargement of the mother external genitalia, relaxation of the maternal ligaments, preparation in labor, in addition to other systemic function. The progesterone formation and preparation of the decidua, relaxation of the uterus, mainly to maintain the pregnancy, so no uterine contraction occurs during the pregnancy. Also, it helps estrogen in preparing the breast for lactation. It is responsible for the vasodilatation of the blood vessels, so decrease in the peripheral resistance. It has natriuretic effect, hyperventilation for washout of CO2, thermogenic and increased thirst feeling, also due to the progesterone, appetite and fat deposition, affect the nutrition and cleavage of cells in early embryo. It crosses the placenta to be converted into cortisol in the fetal adrenals. So it is a substrate for the fetus for formation of the corticosteroid hormones. The progesterone is synthesized from cholesterol, which is derived from low-density lipoprotein. The placenta produces a term 250 mg progesterone per day. most of it bound to corticosteroid binding globulins, and only 5 to 15% of it is free, unbound. The increase in plasma level is about 10 times quantitatively greater than the plasma level of estrogen. So, the increased level of progesterone throughout the whole pregnancy is responsible for relaxation of the uterus and maintaining pregnancy, not to have preterm delivery. But toward the end of the pregnancy, the ratio is inverted, so there is decreased in the progesterone, more estrogen is secreted, it may initiate labor. Other hormones produced by the placenta include human placental lactogen. This is a polypeptide hormone, and it has a general metabolic hormone for the mother and the fetus. Also, it has a prolactin-like effect on the breast, but it is antagonizing the effect of insulin. Relaxin, also produced by the corpus luteum first and then by the placenta, it causes, as we mentioned, relaxation of the maternal uterus and the body skeletal ligaments. Prolactin is present in high concentration in the blood and amniotic fluid, and it is secreted from the decidua. Its function is to regulate electrolyte fluid balance in the amniotic fluid and the preparation for milk production in the breast. The main source in the mother is the pituitary gland, anterior pituitary gland. Its level is decreased in normal labor in the mother but surge in increase 2 hours after delivery as the inhibitory effect of estrogen is disappeared. Other endocrine effects of pregnancy: most of the maternal endocrine glands react to placental hormones, and the metabolic load on the mother, like the pituitary gland, thyroid, and parathyroid gland, may enlarge about 50% of their size during a pregnancy. This hormones or this graph shows to you that this is the red line due to human chorionic gonadotrophin. As we mentioned, early pregnancy is diagnostic for having pregnancy, and so we find it positive in early pregnancy, then peaks about 8 to 12 weeks, and then plateau level throughout the whole pregnancy. This hormone is the progesterone, continue to be high till the time of delivery. Also, the estrogen, the blue line, is increased. The diabetogenic effect of pregnancy is due to the human placental lactogen. It is a lipolytic hormone and anti-insulin, so it antagonizes the action of insulin, so it is increasing the glucose level of the blood to prepare fuel for the fetus throughout the whole day. Cortisol, which is elevated also in normal pregnancy. Prolactin is also increased. Estrogen and progesterone, all these hormones causes more diabetogenic effect, that's to say increase the level of glucose in the blood. The fetal glucose level is 20 mg per deciliter lesser than the maternal values. This will permit more glucose to be transferred from the mother to the fetus, and the placental glucose transport is a carrier mediated through the blood barrier. The pancreas and fuel metabolism, physiological glucose intolerance to ensure continuous transport of nutrient from the mother to the fetus. Again, it is a state of diabetogenic effect. There is fasting hypoglycemia because throughout the whole night, even the women did not take oral feeding, the fetus continued to take glucose from the mother. Hyperinsulinemia due to insulin resistance induced by the mentioned above hormones. Thyroid gland, we have euthyroid state normally. Slight increase in the size of the thyroid. There is the free T4 and the free T3 remain normal, but the total thyroid hormone levels increased. But with it, there is increase in the thyroid binding globulin. So the free is still the same, but the total is increased. Fetal thyroid gland will start to be active by 12 weeks gestation. Regarding the pituitary gland, there is increase in its size, due to proliferation of the prolactin secreting cells. Prolactin level are also increased 10 times higher at term to prepare the breast for lactation. So the pituitary gland size is increased. There is increase in weight gain about 8 to 12 kilo throughout the whole pregnancy, and this increased mainly in the second and third trimester of pregnancy. There is increase also in the basal metabolic rate, especially in the second half of the pregnancy, leading to increased caloric requirements and increased sensation of heat. The diet, the growth of the fetus mainly in the second month of pregnancy or second half of pregnancy, with increased requirement of iron, calcium, phosphate, protein, vitamin D, and vitamin K. The plasma lipids are increased, triglyceride doubled, LDL is increased, cholesterol is increased, free fatty acids are doubled. And thank you. This is the end of the lecture, and I'm ready to answer any question if you need.